I will now be demonstrating how to perform proper post-mortem care in regards to the deceased patient and their family or loved ones. After the last heartbeat of a patient, it is the nurse's job to inform the family and friends of the patient's passing. If the family and friends are coming in after the passing to say one last goodbye and for a viewing, it is once again the nurse's job to make sure that the body is presentable. This includes brushing the patient's hair, wrapping any wounds, making sure their eyes are closed, laying the body flat, keeping all hospital tags on, making sure any dentures are in their mouth, putting a pad under the perineum for any possible leakage, making sure the body is dressed in a clean gown, blanket pulled up, all jewelry is off the patient, which then must be signed by 2 other witnesses, and the area must be conducive to visitation. This includes soft lighting and a clean room. Make sure to ask the family about any possible autopsies and the paperwork that must be done for that, but keeping in mind that some cultures do not allow for autopsies to be done. All paperwork must be done at this time. Allow the family to have as much time as needed to say their last goodbyes. If the family wishes to be alone, then the nurse may leave the room. Be aware of the family's cultural implications and ask if there is anything that can be done in this regards. For example, getting a priest to pray for them or a rosary if Catholic. Allow for specific ceremonies or rituals to be done. You must always make sure to be very respectful. Make sure to ask if they have any funeral arrangements, and if not, you can find the closest funeral home and the nurse can call and have it arranged. This will allow for some less stress for the family. Then the nurse must ask the family if they would like to stay and watch or assist with the care of the deceased person before being taken to the morgue. Most family members prefer not to stay in the room, but if they do, you will start with the head first. There are specific steps in the post-mortem care process, and they are the following, which I will be demonstrating. First and foremost, all nurses must need to remember to put their gloves on for their own safety. Ask again about any jewelry, especially wedding bands, and make sure to have at least 2 witnesses sign off on taking off the jewelry and giving to the family or leaving on the body. Then make sure to clean the genitalia and put an absorbent pad under them due to genitalial leakage. Make sure dentures are in the patient's mouth. Make sure the hair is brushed and groomed. And also make sure to leave on all ID badges. If there are any IVs or tubing, make sure to cut and tie them off. Do not remove the IV or tubing, as this could cause leakage since the body is unable to make platelets to heal the wounds. Change the gown if needed if it is dirty or soiled. Next, wrap pads around the wrists and tie with a string. Wrapping pads around the wrist will allow for a cushion when the body goes into rigor mortis, as the body tends to move and bruise easily. Make sure to not tie the strings too tight, as you do not want this to cause bruising. Then repeat the same steps with the feet, making sure to not tie too tight, but tight enough so that they will not be able to move around. Then place a pad under the chin and tie to make sure that the jaw cannot shift around and that the mouth stays closed. Make sure again to put a tag on the inside of the gown. Carefully put the body in a body bag, but since I do not have a body bag, I will be improvising and using a sheet instead. I will first start with wrapping the head, then the feet, then the right and left sides. I will make sure to tie around the feet to ensure the sheet stays on the body. Lastly, make sure to put another name tag on the outside of the bag or the sheet. When dealing with a child, all of the same steps need to be taken, plus a little more. Many parents or guardians wish to have a lock of their child's hair, and a footprint needs to be taken and given to the parents or guardians. Make sure to put a fresh diaper on the child. Most of the children's arms and or legs may be too short to tie together, so just placing the arms at the sides and the legs straight out in front will work. When dealing with death, it is not easy for anyone, yet it is something that everyone will have to experience, as it is just a part of life. And it is the nurse's job to make sure the experience is as pleasant as possible, while always remembering to show the utmost respect for all individuals involved.